foundation: da'wah, tarbiyah, and education, establishing the foundations of Islamic civilization in South Africa.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والعاقبة للمتقين والصلاة والسلام على رسوله الكريم سيدنا محمد وآله وأصحابه أجمعين برحمتك يا أرحم الراحمين. All praise due to Allah, the Lord, cherisher, nourisher, sustainer and master of the universe, the most gracious, the most beneficent, the most merciful. Ya Allah, it is on you that we worship and it is your guidance that we seek. Ya Allah, keep us on a straight path. Ya Allah, show us the choice of blessings. Ya Allah, show us your mercy. Ya Allah, guide us. Greetings, salam, salutations on our beloved Nabi Muhammadur Rasulullah sallallahu alaihi wasallam. It's time for Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faisal MJ Sulaiman. Assalamu alaikum wa rahmatullahi wa barakatuh. And we welcome our listeners on Radio Al Ansar, CII Radio, Voice of the Cape, Radio 786, Sirius FM, Radio Islam and IFM Port Elizabeth, and all listening to us on audio streaming and other platforms. Our topic for discussion this evening is management of diabetes and other chronic illnesses during Ramadan. And of course, preparing for Ramadan, our concentration and focus, unfortunately, is on food, but we need to prepare ourselves spiritually, we need to prepare ourselves physically, we need to prepare ourselves medically. And we're very fortunate to have with us in the studio this evening Professor Muhammad A.K. Umar, and who is an endocrinologist practicing in Durban. And we say Assalamu alaikum wa rahmatullahi wa barakatuh. Professor, Jazakallah khair for joining me on the program this evening.
Wa alaikum assalam wa rahmatullahi wa barakatuh. It's a pleasure being here.
Thank you once again. Just to introduce Professor M.A.K. Umar, after graduating with the MB-CHB degree at University of Natal, Muhammad Umar specialized in internal medicine, becoming a fellow of the College of Physicians of South Africa and member of the Royal College of Physicians UK. He then further specialized in diabetes and endocrinology, and in the process obtained his doctorate for a thesis in the field of diabetes. He was elected to the Fellowship of the Royal College of Physicians, London, and made honorary professor in the Department of Medicine, Nelson Mandela School of Medicine. Served on the executive committees of the Society of Endocrinology and Metabolism of South Africa, and has been vice president of the Pan-Africa Diabetes Study Group. Professor Mac Umar's CV is very extensive, but I don't want to spend the show discussing his vast CV. But we're very fortunate to have Professor Mac Umar in the studio with us this evening. Professor, now, why do people suffering from chronic illnesses have to take special precautions in order to fast during Ramadan?
Assalamu alaikum wa rahmatullahi wa barakatuh. Alhamdulillah Rabbil Alameen. Wa salatu wa salam ala rasulih al-kareem. Allahumma salli ala Sayyidina Muhammadin wa ala alihi Sayyidina Muhammadin wa sahbihi wa alihi wa sallam. I think that's an important question. Many chronic diseases involve dietary modification. Now, during the Ramadan fast, we stay away from food and drink for, I think in this country now, at this time of the year, about 14, 15 hours. So that's going to have an impact on whatever disease you have, particularly diabetes. Now, just to give you an example, these long days without water can lead to dehydration. That's the first thing. Secondly, if you're a diabetic and you haven't had enough during Shari, or you took your medicines and haven't had enough to eat, of course, then your sugar will fall. So, and in addition, you might indulge in a lot of tea, coffee at Shari, and then that can also cause dehydration with time. So that's why it's important that we look at people who have chronic diseases from a different angle. Here they have to modify their lifestyle, to modify their medicines, and it is for this reason that I think it's important to have programs like these.
Alhamdulillah. And I think it's just important that we get the necessary guidance so we can prepare ourselves and don't fall short. Now, Professor, what are some of the common diseases that have a special impact on health during fasting?
Of course, the foremost disease is diabetes. And as we know, diabetes is concerned with your blood sugar. And we know that you need blood sugar for your brain to work and for your body to work. And if you haven't had enough to eat, or you've taken medicines and not eaten, then of course your sugar will fall low. And that can have an impact on your health. On the other hand, in Ramadan, very often we have these sugary foods, and that will put your sugar up. So that's one, diabetes. Then there are other diseases like hypertension or high blood pressure. Now here, taking your medicines on time is important. People with heart disease, also people with ulcers, asthma. So they all need special attention, particularly if they're going to fast.
And Professor, before moving on to specific diseases, can you outline some general principles to be followed during the fast?
Yeah, and this will apply to everybody, not only people who have disease, even to healthy people. Now, especially in this country, as I mentioned earlier, the fast is about 15 hours, and you can get dehydrated at the time. So that's important, to have enough fluids. And when I talk about fluids, we're talking about water, not so much tea and coffee. I'll come to that just now. You can have water, or even some of these fizzy drinks. That's fine. And the only thing, they have a lot of gas, so that might have an effect. So any fizzy drinks or water is important. And during the waking hour, during the time you are not fasting, say after iftar, make sure you have enough water. You can have it just before Taraweeh, and after Taraweeh you come back, have more water. When you're getting up for Sahri, have more fluids. And here I'm talking particularly about water and other drinks. Now, let's come to tea and coffee. Now, too much tea and coffee can cause dehydration. The reason is tea and coffee got caffeine, and caffeine has a diuretic effect. In other words, caffeine will get rid of fluid in the body. Mm-hmm. So try and minimize that. Maybe just have a sehri and maybe iftar, and not more than that. So that's the first thing, dehydration. And then the other thing, when it comes to general principles, is to make sure that you have a healthy diet. In other words, have foods that are high in fiber. They may be starchy food, but if they're high in fiber, that's very good. And try and restrict your sugary content, the sugar content of food. And this applies not only to diabetics, also to non-diabetics. But, one of the things we find that in Ramadan, you can actually lose weight. And it has been shown in many studies throughout the world that apart from the Ramadan fast, and even fasting at other times, will cause weight loss. And this has been shown in many studies. So these are some of the things when you talk about general principles. And of course, the other thing is, if you are quite ill, if you have a severe flu, then you shouldn't fast. That will have an adverse effect on your health. And you can make up for a fast later on. But then you might have certain chronic diseases where fasting is absolutely forbidden. Somebody with severe diabetes, whose sugar is out of control, shouldn't be fast. And Allah Ta'ala has given us a concession. فَمَنْ كَانَ مِنْكُمْ مَرِيضًا أَوْ عَلَى سَفَرٍ فَعِدَّةٌ مِنْ أَيَّامٍ أُخَرَ. Those who are sick on a journey, they shouldn't fast. And in certain circumstances, they can make up for the fast. So these are the things, and we'll come to the diabetic part later on, but I just wanted to mention some of these general principles when it comes to the fasting.
Jazakallah khair for that, Professor Umar. Just to remind our listeners that this is an interactive program. If you have any questions for Professor Mak Umar, then you may forward them to us via WhatsApp on 060 904 1056. That's 060-904-1056. Now remember, our topic for discussion is the management of illnesses during Ramadan, and let's restrict our questions to that. Now, Professor Umar, what is the impact? Obviously, the impact of fasting is greatest. Is it in any particular disease?
In particular, it will be diabetes. Mm-hmm. And as I mentioned earlier, diabetes means too much sugar in the body. Okay, there are a lot of other abnormalities, too much sugar. So, of course, if you're fasting, your sugar content will decrease in the body. So you must make sure the sugar doesn't go too low. On the other hand, if you're going to go on a binge during Ramadan, eating all these sugary foods, the sharbats and the faludas and those things, and that also will raise your sugar. So it's for that reason that people have to take precautions, particularly if they are diabetic patients. Yeah.
Mm-hmm. And what advice would you give to people with diabetes who fast during Ramadan?
Yeah. Now, first of all, before you fast, it's a good thing to see your GP or your specialist, whoever you see regularly, for advice on that, and then he will give you whether you're fit to fast, what you should do. And it's best done about 4 to 6 weeks before Ramadan. In fact, now's the nice time to go to one of your doctors, discuss your problem with him, tell him what treatment you are on, and can you fast or not. And the doctor will advise you that your condition is such that you cannot fast. There are certain criteria. We're not going to go into that. And if the diabetes is severe, or if you had frequent low blood sugars in the last 3-4 months, then you shouldn't fast. So this is the kind of advice the doctor will give you. And of course, education is very important, not only in terms of whether you can fast or not, but in terms of your diet. Are you going to go on a binge, or are you going to maintain that healthy diet? And of course, the doctor will advise you what foods to eat, what not to eat. And as I mentioned earlier, try and avoid the sugary foods. I know I won't say it's forbidden. You can have it, but in limited quantities. Try and indulge more in high fiber starches. Proteins are fine. Even cut down on your fats. I know many of the goodies in Ramadan contain a lot of fat, so you'll have to cut down on these fats. So these are some of the general principles in terms of diet. And then, of course, the other thing is your medicines, what medicines you're taking. Now, the doctor will advise you on that if you are on diabetic pills, how to take that. There are certain diabetic pills that will lower your sugar for a long time. Here we're talking about what we call the sulfonylureas, or tablets like Dimarcron or Dayonil. These now, again, the dose will have to be reduced. But if you're on tablets like metformin or Galvus, or any of, or even the new ones like Foxidia, then there's no problem. The only problem is with Foxidia, you should take it at night because that can dehydrate you. So here, the doctor will advise you on that. And if you're on insulin, he will tell you whether you can fast or not and how to modify your treatment. And similarly with your other medication, cholesterol medication, which often you find diabetics taken. High blood pressure is very common in diabetics. So even your pressure medicine, your doctor will advise you what to do, how to take it, and what not to take.
Okay. Talk about diabetic medication during fasting. I know, there's one adjusts one's timings, etc. Elaborate on adjusting diabetic medication during fasting.
Yeah, let's briefly. If you are on, say, a tablet called metformin or glucophage, I think most diabetics are on that, so you don't have to modify that or not, because the risk of getting a really very low sugar with metformin or glucophage is very low. So if you are on, say, glucophage 1,000 milligram twice a day, you can carry on with that. But if your sugar is very well controlled, maybe cut the seri dose into half. In other words, 500 milligram in the morning and 1,000 milligram during the night. Then if you are on, as I mentioned earlier, diglucide or Dimarcron, now that needs modification. If you are on, say diglyceride 60 milligram in the morning, 60 milligram in the evening, then what you do, the morning dose, the shehri dose should be reduced by half, but carry on with the iftar, evening dose at iftar. That doesn't need change. Then there are others, like, I mentioned one of those things is Galvus or Jalra. These don't have much of an impact in causing your sugar to fall. So you can carry on with the same dose. Similarly, with the one I mentioned earlier, there's a tablet called Foxidia or Jardiance. Now, these work by inhibiting the kidneys from taking your sugar back. So you pass all the sugar in the urine. Now, even that doesn't need any modification. And insulin, yes, well, again, the doctor will decide whether you can fast or not fast. And even that might need modification.
060-904-1056. We are discussing preparation for Ramadan and preparation, especially if you have any medical conditions. Our special guest is Dr. M.A.K. Umar, an endocrinologist practicing in Durban. And if you have any questions, just to repeat, 060-904-1056. Now, Professor Umar, which patients with diabetes are advised not to fast?
All patients with type 1 diabetic shouldn't fast. Now, by type 1 diabetics, we mean diabetics who are on insulin from the word go. They usually have the diabetes either in childhood or in the teenage period, and they are always on insulin. In fact, insulin is life-saving for them. So for them, we say, no, you cannot fast. Then on the other hand, if a diabetic is not well controlled, and what you mean by poor control, we look at what they call the HbA1c. I'm sure all of you heard of it. This gives the average sugar levels over the last 3 months. And if your HbA1c is more than about 8.5%, you shouldn't fast. And then the other one thing is, if you've had a low sugar in the previous 3 months, then you shouldn't be fasting. And again, if you have diabetes complicated by severe kidney disease, in other words, your kidneys are failing, you cannot fast. And what are the other things? Even if diabetics often have severe heart disease, and if you got what we call unstable angina or severe angina, then you shouldn't be fasting. So these are some of the, conditions that will, prevent one from fasting. And your doctor will give you this advice. You shouldn't fast at all, but then it will be detrimental to your health.
Professor, does testing one's blood sugar while one's fasting, does that break the fast?
No, that's it. I'm glad you asked that question, because if you test your blood sugar, it doesn't break your fast. It's very important. Now, I'll just elaborate on this. Now, any diabetic who is fasting should test the sugar at shehri time. Then they should test it at about maybe 8, 9 o'clock, then test it again at 1. And very important, one of the most important times to test is in the afternoon, say about 4 or 5 o'clock. But that is when it is likely that your sugar will fall tremendously. So therefore, especially in the first few days of your fasting, check your sugar. Then, of course, you'll check your sugar about 2 hours after breaking your fast to make sure it's not very high. So diabetics, yes, they can fast, even if they're on insulin or some tablets, but they have to test their sugar at least in the first week about 4 or 5 times a day. And then after that, once, twice a day is sufficient.
Professor, you did mention that, the most important test is in the afternoon, say by Asr or so.
Yeah.
Now, what happens if you find that your blood sugar levels are seriously low at that time?
Yeah,
it was like an hour before Maghrib.
Yeah, that's right. Now, if your blood sugar is under 4, break your fast, because your sugar is not going to go high. Now, that's it. Now, Allah Ta'ala has given that concession. I mean, if it's going to be detrimental to your health, break your fast. On the other hand, even if your sugar is very high, in other words, your sugar is more than about 15, 16, then you should break your fast too. So it both ways. If you find your sugar is under 4, break your fast. If it's more than about 16, 15, 16, then again you should break your fast. Because, remember, high sugar itself will cause dehydration, and it can even push you into what we call coma or ketosis, which is a very severe form of diabetes.
Mm-hmm. And what advice would you give to people with other chronic diseases like high blood pressure and heart disease during fasting?
Yeah, now, when it comes to high blood pressure, it's simple now. Nowadays, we got medicines that you can take once a day, or maybe some twice a day, but generally once a day. So there's no problem. But make sure you take your medicines. Now, if you look at your medicine for high blood pressure, there are various classifications. One of them are diuretics. And I'll just give you some example. One is Redac. Then the other one is what they call Natrelix or Dapamax or Dapril. Now, if you are on that, take that in the afternoon, in other words, at iftar, not in the morning. Otherwise, all your other pressure tablets, just carry on as you are doing it. Now, we know that people with high blood pressure should have a low salt diet. So make sure, even in Ramadan, that you're not using extra salt at the dinner table. By all means, you can cook with salt, but don't add at the dinner table. And again, hypertension, if you got high blood pressure, make sure you drink enough fluids, You don't want to be dehydrated. That's in terms for high blood pressure. Now, what about people with heart disease? Now, if your heart disease is stable, your doctor will tell you that, then you can fast. There's no problem. But again, make sure you take your medicines. And today, for people who are heart disease, we got a lot of medicine which you can take only once a day. We call them the beta blockers, can take once a day. Then the other one is nitrites, or what they call isobide, that you can take twice a day. So there is no problem. But make sure you take your medicines. Not that in the Ramadan you must omit your medicines. And if you do that, there should be no problem.
Jazakallah khair for that. We're going to be taking an ad break, and then we'll take a break for the Isha Azan for the Durban area. We'll continue after this, inshallah.
This Adhan is sponsored for the Isale Sawab of Marhum Muhammad Farooq Latib and all Marhumin. May Allah subhanahu wa ta'ala grant them the highest abode in Jannah. Ameen.
Allahu Akbar, Allahu Akbar, Allahu Akbar, Allahu Akbar. Ashhadu an la ilaha illallah. Ashhadu an la ilaha illallah. Ashhadu anna Muhammadan Rasulullah. أشهد أن محمدا رسول الله. حي على الصلاة، حي على الصلاة. حي على الفلاح، حي على الفلاح. الله أكبر، الله أكبر. لا إله إلا
اللهم رب هذه الدعوة التامة والصلاة القائمة آت محمدا الوسيلة والفضيلة والدرجة الرفيعة وابعثه مقاما محمودا الذي وعدته وارزقنا شفاعته يوم القيامة إنك لا تخلف الميعاد.
This dua brought to you by Simplex Radio, South Africa's leading retailer of appliances, car sound and home theater systems.
These surahs after Azan are brought to you by Amina's Wonder Spice and Wonder Dates, 9 Peters Road, Springfield, Durban.
بسم الله الرحمن الرحيم قل هو الله أحد الله الصمد لم يلد ولم يولد ولم يكن له كفوا أحد.
A comfortable home is every homeowner's pride. That's why Khan's Chemicals have developed and manufactured prime yet affordable quality household brands Starlight, Miracle Mum, Exterminate and Angie to care for your home and family. With a wide range of fabric softeners, dishwashing liquids, bleachers and all-purpose cleaners, pine gels, bubble baths and much more. Khan's Chemicals ensures your home remains our number one priority. For sales and other inquiries, call 011 933 4021. Khan's Chemicals, cleaning your home the way you want.
Jamshed brings you Summer Clearance Sale with up to 50% off on all items. Avail the most exciting offer from 23rd January to 2nd February 2025. Visit our store or shop online at ca.todayjamshed.com.
Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD, and now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha and more for quality audio visual experience. Now available full range of home appliances. A one-stop shopping experience. Call 031 306 4029 or Kenilworth Park, 202 Brickfield Road, Overport. Simplex Radio, the name you can trust.
The Al Ansar Foundation, Da'wah, Tarbiyah and Education, establishing the foundations of Islamic civilization in South Africa.
You're listening to Medical Files brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faisal MJ Suleiman. We are discussing the management of various illnesses during Ramadan, and our very special guest this evening is Dr. M.A.K. Umar, an endocrinologist practicing in Durban. Professor Umar, there's several questions that have come through. I'm going to pose some of the questions that have come through. The first question says, I have high blood pressure. I take 20 milligrams. Well, they don't say which tablet, but okay. But should I take it in the morning?
Yeah, that's a good. Probably you're taking Pharmapress or one of those. That's 20 milligram. Or maybe Lisinopril, one of those. So, no, you can take it in the morning. There's no problem. If you're on that alone, you can take it in the morning.
The next one says, Salams, I'm 68 years old and currently on glucophage 500 milligram XR, 2 in the morning, 2 at night. Sugar level hovers between 8 to 10. Is that fine to fast? I'm also on Cardicor 2.5 mg as I had a triple heart bypass. I would have listened on radio, but it's Isha time and I'm going to switch off my phone. Can I get a reply here, please? Okay. Maybe you can. I'll send them a podcast, but maybe you can deal with that question, sir.
Yeah, no, okay. Now, if you look, if your blood sugars are between 8 and 10, I would say it's not optimal. 8. What we want generally, the sugar to be less than 8, at times up to 10 is acceptable. Now, in your case, you can fast and just carry on with the glucophage as you are taking. And make sure you monitor your sugar, as I told you. And your diet is important, even in Ramadan.
Professor, diabetes patients on insulin, I think, can they fast?
Yeah, no, that's, initially I mentioned the type 1 diabetic patients who are on insulin from the word go, from the time they have diabetes, cannot fast. But now there are other patients who are on insulin. Now, here, these are the patients who were on tablets or pills for years, maybe 2 years, 3 years, 10 years, 15 years. And then because of poor diabetes control, they are put on insulin. Now, these patients can fast, provided the control is good. And here again, I say HbA1c must be under 8%, preferably under 7.5%. Now, there are different ways of taking insulin. Some patients will be on insulin at bedtime only, and during the day they take their medicines. Now here they must carry on with their insulin if you're fasting, but then take your insulin not at bedtime. Take it around about after iftar, and cut your insulin down by about a third. So in other words, if you're on 30 units, then you take 20 units. Now these are the ones who are on what they call a slow-acting insulin. The examples are Opticillin, Bezagla, Lantus, these are the ones. Then there are other patients who take insulin twice a day, thrice a day, or 4 times a day. Now, if you're on twice a day, generally you'll be on what they call pre-mixed insulins. These insulins are a mixture of short-acting insulin and a long-acting insulin. Now here, if you are taking twice a day and your doctor has said your control is good, you can fast. But what you have to do, the sehri dose of insulin must be cut by 50%. So cut your sehri dose by 50%. So if you're on, say, 20 units in the morning, then you take 10 units of sehri. But the evening dose, leave it at same, whatever you are taking. So that should be on twice a day. Some people might be on thrice a day premix. Well, okay, then they have that dose at lunchtime, so it doesn't matter. Here they are fasting; they won't take the midday insulin. Then there are others who take insulin 4 times a day. They will be taking insulin before breakfast, before lunch, before supper, and at bedtime they will taking the long-acting insulin. Now here what you do, of course, again the sehri time, you reduce the morning dose by 50%. Say normally they take about 30 units at in the morning before breakfast. In Ramadan, at sehri they'll take 15 units. But whatever dose they take, and of course lunchtime they'll take no insulin, we are not eating. But the insulin that they take at supper time will be the same dose that they will take in Ramadan. So assuming they are on 40 units, before supper. So that's what they'll do. They take 40 units at iftar time. And then again, they may be on, as I said, bedtime insulin. This is the long-acting insulin, like Opticillin or Bezagla or Lantus. Now here, generally, you can cut your insulin down by about 25%. And here, you can either take it after iftar or even you can take it at bedtime. But now, because, the nights are short, you rather take it just after iftar. So these are just the principle of insulin. But it is very important. Don't take the same doses of insulin in Ramadan as you were taking before Ramadan. And particularly the morning dose, the sehri dose, has to be reduced. But many diabetics on insulin can safely fast, provided. And if you are on insulin and you are fasting, it's absolutely mandatory that you check your sugar, as I mentioned earlier, before sehri at about 8 o'clock, 1 o'clock, about asar time, 4, 5 o'clock, and after iftar, 2 hours after iftar.
Jazakallah khair. 060-904-1056. If you have any questions for Professor M.A.K. Umar, please forward them to us via WhatsApp. Now, Professor, a person taking metformin or glucophage twice a day, do they need to make any changes?
By and large, they don't need to make any changes because, as I mentioned earlier, metformin has a very low risk of, lowering the sugar.
Okay. And what about persons who are taking metformin or glucophage and a sulfonylurea? What change do they need to make?
Yeah. Now, if they're on a metformin and say SU or sulfonylurea like diglycide twice a day, then what they'll do, the morning dose of glucophage or metformin will be the same. So in Ramadan, they will take the same dose. But they must cut the diglycide or glimepiride, one of those, that you must cut by half. If they're on 60 milligram, then they should take 30 milligram. But they may be, and then the evening dose, they may be on 60 milligram, you leave it at that. But then they may be taking diglycide 30 milligram in the morning, 30 in the evening. Then what they do, you don't take any diglycide. At Sheri, just take the metformin alone. And at iftar, you take the 30 milligram diglycide and you take your metformin. And if you are on once a day diglycide, say taking only in the morning 30 milligram, then you don't take it at Sheri, take it at iftar. There are people who take diglycide only once a day.
Question from a listener. Assalamu alaikum. I am 71 years old and during Seri I take 2 Panados and ulcers tablets and blood pressure, amlodine 5 milligrams. And how should one take ulcer tablets and when I have to take it? Because I have very bad lower back and stomach cramps, stomach pains. Jazakallah khair.
Yeah, I know. I think, today, in the old days, fasting had the bad effect on ulcers.
Mm-hmm.
But now we call them the PPIs, all these Nexium and all those things. I think they've made life easy for for people who fast. So what I would suggest you do, in the morning, you take your ulcer tablet, take your Panadol tablet. There should be no problem with that. And if you're on a pressure tablet, you can even take that. Sometimes if you get bad ulcers, you might have to take your PPI twice a day. Occasionally we have, if you got severe stomach cramps. But if you're managing with that, you should. The other very good thing for ulcers is to take yogurt. Either low fat, but plain yogurt. But that also has a beneficial effect in relieving pain of ulcers. And if you're a diabetic, try and take the low fat, plain yogurt. That also has a beneficial effect on your blood sugar levels. So for you, carry on with the ulcer medicine. And Panado is safe. But what you should do, if you've got ulcers, avoid all anti-inflammatory. By anti-inflammatory, we mean things like Brufen, Voltaren, Miprodol, Mibulin, Cataflam. If you have ulcers, you shouldn't be taking that. And just stick to Panado, or you want something stronger, like Stopain, Trimacept. Those are safe for ulcers.
Professor, time for us to take the next ad break. We'll continue after this. To stay with us, inshallah.
Radio Al Ansar, Durban, South Africa.
The trucks have arrived and stocks are in. Wonder Dates have the largest variety of dates from Medina, Dubai, Iran, Tunisia, and Namibia. They stock a huge range of spices, nuts, dried fruit, and best of all, your Ramadan goodies at the best prices. So, for everything nutty, nibbly, chewy, munchy, spicy, sweet, sour, and savory, make a date with Wonder Dates, bringing the freshness of the farm to your home. 9 Peters Road, Springfield Park, Durban. Contact us on 031 577 7722. Call now.
At this time of trial and worry, the blessings of charity are the ideal means to avoid calamity and despair. The Al-Imdad Foundation gives you the opportunity to sponsor a share in a borehole in South Africa for just 1,000 rand and provide what the Holy Prophet, peace be upon him, called the best form of charity. Donate online at alimdad.com or call 0861 786 243 for more information.
It's official. Checkers Foods Kawi Park is our first food store with a halal butchery, bakery and deli certified by NIHT, the National Independent Halal Trust. This will ensure high standards and ethical practices across our butchery, bakery and deli from farm to table. So visit Checkers Foods, Cowie Park for an exceptional shopping experience that keeps getting better and better.
This segment is brought to you by Kenfield Auto, your RMI approved service and repair specialist. 236 Brickfield Road, Overport. Kenfield Auto.
بسم الله الرحمن الرحيم رب اجعلني مقيم الصلاة ومن ذريتي ربنا وتقبل دعاء.
Car won't start?
Kenfield Auto.
Noisy brakes?
Kenfield Auto.
Due for a service?
Kenfield Auto. Kenfield Auto, the answer to all your car problems. Your service and repair specialist for your VW, Audi, Suzuki, Toyota, or just about any vehicle. Kenfield Auto, your RMI and insurance approved workshop to handle them all. 236 Brickfield Road, Overport. Call us on 031 207 2399. Kenfield Auto.
Al-Ansar International.
You listen to Medical Files brought to you by the Islamic Medical Association of South Africa, and we are discussing management of various diseases during Ramadan, especially diabetes. Our special guest is Professor M.A.K. Umar, an endocrinologist practicing in Durban. Now, Professor, there's a few questions coming. One question is, my mother is 75 years old. We just checked her sugar now, and it was 26. What's the best to bring sugar down?
Now, she's now, 26 is a dangerously high level. You can go into coma. The thing that will bring it down will be insulin. Now, what I suggest, with such a high sugar, you should see a doctor and maybe even go to the outpatient department of one of the hospitals. Where 20 pills will do nothing, give you any pills. She needs insulin and to be monitored carefully. In order to bring it down. Yeah.
The other question is, what about leg cramps when fasting, and what should one take? How much? Okay. Also, how much dates can one consume during Sehri and Iftar? I think there's two questions in one.
Yeah, okay. Now, first of all, about cramps. Now, as I mentioned earlier, during the Ramadan fast, you become dehydrated. And when you are dehydrated, you lose salt and you lose potassium. Now, the cause of the cramps could be a low potassium, sometimes a low sodium, but also low magnesium and calcium. So make sure that if I had this cramp, I'll make sure I'll take magnesium tablets every day. You can take it at Sehri and Iftar. And now coming to the question of dates, you can have about 3 dates at Iftar, 3 dates at Sehri. And that should be fine. And you're fulfilling the sunnah.
Professor, there are different types of sulfonylurea available. Which are the better ones?
Now, in fact, the best one at the moment is what they call the diglucide, or they got different dimicron. The chemical name is glycoside. The other ones were glycamin or Dernal. Now, those are very potent and they could really cause severe low sugars. So we hardly use them. So the safest, I would say, will be this diglucide or dimicron. The other one is glimepiride. Okay, that I would say is in between. So if you ask me what you should do, use diglucide. The chances of getting a low sugar are rather less compared to the other sulfonylureas.
And a person that's taking metformin or glucophage and a DPP-4 like Jalra, what changes should they make when fasting?
In if they're on a DPP-4 inhibitor and metformin, there should be no change. The only thing is, what they say is they may be on metformin twice a day, and it's DPP-4 like Jalra or one of those. Then what they should do is, at Sehri time, or if they're on twice a day, just take the metformin, and at Iftar, take your Jalra and metformin. So, but generally, again, these DPP-4 inhibitors have a very low risk of a low sugar.
And are newer medications tending to cause less hypoglycemia?
Certainly. I think, most of the newer medicines have very little, like, we just spoke about the DPP4 inhibitors, then the other one, the SGLT2 inhibitors, like Foxydia or Jardiance. The chances of hypo are very less. And then, of course, you must have all the injectables. We call them the GLP analogs. And here we are talking about, Victoza, plus now Ozempic, and now the Mounjaro that just been released. The chances of getting hypoglycemia are very remote with these newer agents.
Just to remind our listeners that doctors and guests on the Medical File program will help you with any medical problems you pose by giving you advice on air. However, they do not have your full medical history and have not examined you. Please verify any advice given to you on air with your regular doctor who knows your medical history, your allergies, etc. Neither the doctors nor the relevant radio station nor the Islamic Medical Association of South Africa will take any responsibility for any adverse reaction caused by the advice given on Medical Files. Professor Umar, diet control in people with diabetes is crucial. Do people on medication still have to be on a strict diabetic diet?
Definitely. The medicines are not a substitute for diet. So whenever we say diet plus medicines. So when somebody is newly diagnosed diabetic, we say diet and we start with metformin immediately. That doesn't work. Diet, metformin, we might add glycoside or one of those tablets, but diet is the fundamental, basis of managing diabetes.
Question that comes through, what about exercise?
Oh, exercise is very important too. And I think, the best exercise is you don't have to start jogging or anything, is walking. If you can walk briskly for about half an hour, at least 3 times a week, if you can do it every day, all the better. That has a tremendous impact on your diabetes control, on your weight, and on other aspects of your physical being. Now, what about Ramadan? Now, if you're going to do exercise in Ramadan, don't do it during the day. You can do it, but you can do it, but at night. You should do it maybe after Taraweeh or something. Taraweeh itself is a form of exercise, but do it then, during the non-fasting hours.
Now, during Ramadan, many sweet dishes are prepared. What are the foods that people with diabetes should keep away from always?
Yeah, well, as I said, all the sugary stuff, what they got, a sharbat and all these, what the daiwaras and puddings and those things. You should. Okay, now, we don't want to be too strict. What you can do is they can have a little bit, just a little bit, so they're not deprived of it. And one more thing, while we're on it, when you're making samosas and all that, try and air fry them. It'll be better than that. And now, if you're preparing these puddings, you can use the sweetness. But again, there's a lot of fats in those things too. So if you want to, you can have very little. By and large, I would say you'd rather avoid. Because, if you take a little bit, you're tempted to take more and more. So best avoid it. And if you want some dessert, fruit. All fruit are good. And for diabetics, nectarines, cherries are very good. Strawberries are good. Plums, peaches, they don't put your sugar. Apple, then you got mandarin. Watermelon, about 2 pieces only. Grapes, maybe about 8, not more than that. Mangoes are very high. I know it's a season now. Maybe a couple of small pieces. But there are a lot of other fruit you can eat. And there'll be no, like kiwi fruit, all of those are all good for diabetics. So have that instead of your desserts.
And what sort of snacks can people with diabetes have after Taraweeh? That is, another time, and a lot of sweet things like ice cream, sweet desserts, etc. available.
Yeah, again, I must say, they'd rather have fruit. Have more fruit. Yeah,
okay.
I think that's the snack. Okay, they can snack on nuts. That won't be too bad. But by and large, have your fruit.
And Prof, how can individuals ensure adequate hydration during Ramadan, especially in hot weather?
Yeah, now this is the thing. In Ramadan, what you do, as I said, at Sheri, make sure you have enough fluids or no water. Try and avoid too many of these beverages like tea and coffee. You can have 1 cup if you want, but not more than that. And try and have water right through. Then, of course, you're fasting. Then at iftar, have your fluids again, water, fizzy drinks. If you're not affected by gas, you can even have that. Or fruit juices if you're not a diabetic. If you're diabetic, you shouldn't have the fruit juices. Then again, drink water at the time of iftar. Then just before you go for Taraweeh, after Taraweeh, again, drink some water. Before you go to bed, drink some water. When you get up in the morning, first thing, drink water. And then during your shari, after that, drink water. And I think in that time, you'll find enough, you'll have enough fluids to prevent you from dehydration.
Jazakallah khair. Doctor, we've got like 2 minutes to round up the show. Before I ask you for your advice, just one final question. What are the common health issues that arise during Ramadan and how can they be prevented or managed?
Yeah, now when it comes to diabetes, the main issue is the very low sugar, and I spoke about how you can prevent it. The other one is, of course, dehydration, and we just spoke about having enough fluids. And the other thing, the sugar might be too high. Now, again, that you'll have to be managed, but sometimes it's too high. They have to be hospitalized, given fluids, given insulin. So these are the main things and then what can happen in diabetics is that they might, feel very drowsy. They might not eat, and that's because the sugar is very high. So these are some of the problems a diabetic might have. The main thing there is, as I said, dehydration, a very high sugar, a very low sugar, and sometimes infections you can get.
Professor Amir Umar, Jazakallah khair for joining me in the program this evening. Alhamdulillah, the discussion has been very inspiring, very informative and educational as well. May Allah subhanahu wa ta'ala accept your efforts and reward you abundantly. Amen. Professor, before you leave us in 30 seconds, you have a message for our listeners?
Yeah, the message is the Ramadan fast. There are a lot of benefits to fasting. Here we spoke about diseases, but there are a lot of benefits for fasting. Fasting can cause weight loss. It can help high blood pressure. It has a beneficial effect on immunity, and even a beneficial effect on diabetes control, provided you follow instructions. So what I said, there are a lot of benefits. I'm not talking about the spiritual. There are a lot of spiritual benefits. We're talking about the physical benefits. So there are a lot of benefits. So by all means fast, but follow your doctor's advice and don't overdo things. Yeah.
Jazakallah khair, Professor Umar. And we discussed, potential problems and management of potential problems during the month of Ramadan. I want to thank you for joining us on Medical Fast. Thank you to all the engineers in the various radio stations for the sterling piece of work that you've done. Time for me to bid you farewell from myself, Faisal M.J. Suleiman. It's Assalamu alaikum wa rahmatullahi wa barakatuh.